So hi everyone. Next we are going to deal with the part 2. It is about ergot alkaloids. The introduction portion. They are the most active components of ergot, which was obtained from the fungus Claviceps purpurea. They are grown on array and grains. The following classification are in the levo forms: amine alkaloids, amino acid alkaloids, dehydrogenated amino acid alkaloids. So in the amine alkaloids, they contain ergometrin, methyl ergometrin, dihydroergometrin. In the amino acid alkaloids, ergotamine, ergotoxin, and ergosan. In the dehydrogenated amino acid alkaloids, dihydroergotamine. About the importance, effective via oral route and produced marked contractile response even in small doses. Lack sympatholytics, vasoconstrictor as well as emetic activity. Produces mild side effects. The mechanism of action. Ergot alkaloids exhibit agonistic, antagonistic and partial agonistic activity at alpha adrenoreceptors and serotonin receptors. The uterine stimulant action is mainly attributed to the partial agonistic activity at 5-HT2 and alpha adrenergic receptors. They exhibit agonistic or partial agonistic activity at the central dopaminergic receptors. They also possess high affinity towards presynaptic or postsynaptic receptors. So regarding the pharmacological action in the uterus, ergometrin and its derivative increases the force and the frequency of uterine contractions. In small doses, the contractions are sustained with normal relaxation in between consecutive contractions, whereas in larger doses, the force and frequency of contractions increases and there is no relaxation in between. So regarding this, there are small doses as well as larger doses being provided. In the case of the small doses, generally, in between the consecutive contractions, there are normal relaxation occurs with the small doses. While in case of the larger doses, the force as well as frequency of contraction increases and there is no relaxations in between. So next is about the uterus at full term and soon after delivery is highly sensitive to ergometrin and its analogues. Methyl ergometrin is 1.5 times more potent than the ergometrin in its uterotonic actions. So the cardiovascular system, ergometrin and methyl ergometrin are relatively weaker vasoconstrictors than other ergot alkaloids and hence capillary endothelial damage is also less likely to occur at higher doses. They do not increase the BP to a significant extent. So in the CNS, at normal doses, ergot alkaloids have no effect on the CNS, but at higher doses, they exhibit agonistic or antagonistic effect at adrenergic, dopaminergic, and serotonergic receptors. In the case of the GIT, in larger doses, they increases the peristaltic movement of the gut. Ergometrins and methyl ergometrins are rapidly and completely absorbed from the gut. Their onset of actions start within 10 to 15 minutes after oral, 3 to 5 minutes after subcutaneous, and 1 to 2 minutes after intravenous administration. The plasma half-life ranges from 1 to 2 hours. They are metabolized in the liver and their metabolites are excreted via urine. So regarding the pharmacokinetics, amino acid ergot alkaloids, ergometrin and methyl ergometrin are rapidly and nearly completely absorbed from the oral route. The onset of uterine action is oral 15 minutes, intramuscular 5 minutes, intravenous almost immediate. They are partially metabolized in the liver and excreted in urine. Plasma half-life is 1 to 2 hours. Effects of single dose last for about 3 to 4 hours. Regarding the adverse effect, nausea, vomiting, hypertension and prolonged therapy with higher doses causes a decrease in the milk secretion. Serious effects are rarely seen. Contraindications not used in conditions like obstructive vascular diseases, hypertension, hepatic and renal failure, pregnancy, and during first and second stage of labor. So the therapeutic uses. They are used to prevent uterine atony after cesarean section and in the diagnosis of the variant angina. So this uterine atony is said to be a serious condition that can occur after childbirth. It occurs when the uterus fails to contract after the delivery of the baby, and it can lead to a potentially life-threatening condition known as postpartum hemorrhages. So they are also used for normal uterine involutions. A dose of 0.125 milligram of ergometrin or methyl ergometrin is usually given thrice a day orally for a week after childbirth to promote normal uterine involutions, to prevent bleeding and spread of infection. So ergometrin and methyl ergometrin are the drugs of choice for the prevention and treatment of the postpartum hemorrhages. An intramuscular dose of 0.2 to 0.3 mg is usually preferred, and an intravenous dose of 0.5 mg is given for immediate effects. Thank you all.